Yes, we can see your presentation.
Okay. I can see some background noise if it's possible. Is everybody?
I'm just going to
Me?
mute everyone just in
Okay,
case.
thank you.
I might muted you by mistake, Rona, as well. So just unmute yourself if I have.
Okay, maybe it's you, Alfonso, then. Okay. Hello, everybody again. My name is Rona, and as Reina already introduced me, I won't spend more time in introductions because actually, as also Reina said and admitted, I'm also not very good with timekeeping. So the presentation is a bit long, and I like talking and sharing. So let's just start, because I think I have up to sort of 10 to 5 to talk. Just please take notes of your questions if you have any. It would be nicer to see more faces, but I understand it's a subjective choice. But anyway, I'll be talking to my to Reina and Sheena. Thank you for showing your face. Nice to meet you. Okay, so this presentation is about positive parenting for vulnerable families, and particularly migrant and refugee families, because as we covered last week in depth, this presentation is essentially based on the Yene 8 project, which is an Erasmus Plus study devoted to empowering migrant and refugee families with parenting skills. Sorry, I just need to close my window because obviously the neighbor decided to redo his fence in the garden, and it's been working all day. Anyway, so the assumption behind the project is that migrant refugee children are exceptionally in need of emotional well-being and attention, and that parents are extremely important to favor that. And the Yene 8, for this reason, the Yene 8 is aimed to raise awareness around these issues, in particular for unsettled and in transit families, as we said. And the main output of the project has been the creation of a training and support package to enhance parenting skills and to empower migrant refugee parents, as we also said. And one of the main principle of the project has been the cultural competence and a cultural competent and compassionate approach. So we covered this last week, and now what we're going to do today, based on the detailed training and curriculum that was developed within Yene 8, we're going to focus around a few topics that you can see circled in green. And of course, these topics have been readapted for this presentation, and also having in mind a target population a bit larger than only refugee families on the go. As you can see, these different macro units are divided according to the contracts of the model of culturally competent and compassionate care. And within each unit, we developed some smaller subunits based on the age of the children. So let's see. Let's move on. The first concept is cultural awareness, as we said last week. And what we're talking about briefly today is the importance of learning within healthy boundaries. So learning, it's a key element of development in children, and throughout their childhood, children keep expanding their capacities for solving problems, gaining information, and they become obviously increasingly aware, independent, and resourceful. So learning is a key component of development intended as a broad concept. So not only cognitive development, but learning occurs via a plethora of means and ways, and in the different areas of emotion, body, social skills, and of course also cognition. It is therefore important that there is an age-appropriate stimulation, because at different stages of the growth, children keeps developing different needs and I'm going to say and necessities in terms of keep expanding the neural connections and their age and their social skills and so on. So curiosity, learning, and creativity keeps changing, and parents are invited to be aware of these. If you think about the development in young children in vulnerable families, then we all know that these can be associated, if not hampered, sometimes challenged by some specific issues, which can be related to the parents' mental health, their own mental health in their development, psychosocial issues in terms of domestic violence, communities, and also, of course, the condition of refugeedom, which is very, very often the result of torture, mass violence, and abuses. So learning as a route to development, as we mentioned, should be very much observed and taken care for among children in vulnerable families. And one way that these can be supported is also by the establishment of healthy boundaries. So in parent and child parent-child relationship, it is usually the adult who sets and maintains healthy boundaries in order to guide and protect the child. Sometimes, as we have mentioned, the disruption of family structure and the unsettled status of parents can lead to a loss of identity and control as parents. And on the other hand, children can manifest internalizing and externalizing behavioral problems, which require the establishment of limits, as well as a sense of being protected. In the discussion, we can maybe give some example of internalizing and externalizing problems, unless you're all already familiar with these. Parents who can be emotionally distraught or in difficulties can lead to unhealthy boundaries, such as overprotectiveness or harshness, or even a reversal of parents and child role. In the literature, usually we come across 3 different types of boundaries, which are all very important, and they're physical, emotional, and behavioral. And there are some suggestions that it would be good to follow, which they all revolve around this idea of talking to your child to explain why boundaries are set and why we are saying no. Also, because children will test the limit and they will constantly negotiate new boundaries, which is also good because it is a sign of their development and their growth and their changing needs. But it's a constant negotiation that must be carried on in a healthy way. That means based on communication. And another aspect of boundaries that they, instead of becoming limits or a negative thing, they actually can constitute a safety net for everybody, especially in among vulnerable families, where often the other aspects of life or the world around, societies and so on, can be again disrupted or unsettled, etc. So an agreed routine and some agreed rules can be very beneficial, and they can also lead to a perpetuation of some cultural habits. For example, in the case of families who have migrated into another countries, or in case of mixed couple, for example. So here we have listed tips and ideas to support children learning through playing within safety boundaries. We won't go through each of them. We can come back to this slide if you want to, and I'm sure we will circulate this PowerPoint so you can have a look. But the idea of this is that all should be based on communication, using words a lot, but also playing and doing things together, moving together, and trying to to involve the body, mind, soul construct in the relationship with your child, towards an exploration of the world around, and also of the emotions that both parents and children can go through. So from something that is, we said it was based on the cultural awareness, and it was based on development and learning, we now switch the focus on cultural knowledge, and the topic is indeed something more tangible and practical, but nevertheless equally important, which is nutrition, hygiene, and health. I'm not aware of how relevant this can be in the families that you all work with, but still we do know that nutrition is vital for maintaining well-being and mental health, and we also know that often poorer, let's say, or more disadvantaged classes in society do have poorer level of nutrition, and therefore poorer level of health. This is a massive public health issue, so it's still important to talk about this. So nutrition, we know, is the process of providing or obtaining the food necessary for health and growth. And hygiene refers to the condition or practices which are conducive to maintaining health and preventing diseases as well. So talking about nutrition and hygiene, as I said, with unsettled and vulnerable family is key to keep both parents and children healthy. And with healthy, we don't only mean transmissible diseases, but also mental health, for example. We also know that food, other than being technically defined in terms of nutrition, can give us a feeling of comfort indeed and satisfaction. So it is important also to balance the knowledge we have about what is good and what is not for our bodies with what is linked to our identity and culture, because food is a key component of our cultures, of course, and it is also a way of again perpetuating habits and customs within the household from generation to generation. So again, families who have migrated, sometimes it is unsettling for them to having to change completely the diet. So one way social workers and healthcare professionals can show cultural knowledge and cultural sensitivity is about finding a balance between what families can find, what is good for them, and what the culture is leading them to consume, and also to understand that over consuming comfort food can be damaging as well. And in terms of personal hygiene, well, this involves maintaining the cleanliness of our body and our clothes, and again is very much culturally determined as well. So something in some cultures, certain habits of cleaning clothes or changing clothes are totally different than in another culture. But still, it is very important that some key messages are passed on, which is, for example, the hand washing and hand sanitizing, or boiling water, and of course changing washing clothes and the cooking utensils. But this has to be passed on, as also several humanitarian interventions in the global south have taught us. It has to be passed on in a culturally appropriate way. Otherwise, it will not. The message will not reach the families we're trying to help. So going back on to the, but actually all the units, as you can see, are very much interlinked within each other. But going a little bit back onto the emotional well-being and the importance of play that we mentioned when we talked about learning. So we know that since from when children are babies, from 0 of age, their emotional well-being is very much linked and somehow dependent to the well-being initially of mom or of the main carer, and then progressively dad, and then the larger and extended families and relatives as well. And as I mentioned before, their emotional well-being is very much linked to their intellectual development, as well as the learning and skill building and creativity, and overall happiness. It is important to underline that emotional well-being does not mean an absence of emotions or stress, but on the contrary, it means building an awareness and a capacity to recognize which emotions are arising, and healthy way to regulate them. So, which is not suppressing them, it's regulate them. So seeing them and learning ways to deal with them. There are many books about how to recognize emotions, typically associating them to colors, for example, which can work for children, but again, not in all cultures. For example, anger is associated to the color red. So it is again important to listen to the families we are trying to help, and see how they can find their own ways to work with the children to regulate emotions, for example, and what emotional well-being means for them. And play. So I think we have decided to join these two topics together, because they're very much interlinked in terms of creating joy, establishing a joyful environment within the household, which is sometimes something very difficult to achieve, but also at hand in a way, because play can be playful situation, playful jokes, little games can be actually implemented when sometimes nothing else is available in terms of resources or other things. And play, as we said, has a very, very positive impact on cognitive development, emotional well-being, and social skills, and can be incorporated in all routine situations, even if even if not much resources are available, and there's often conditions are material conditions around are scarce. So some key points that I have already kind of touched upon regarding play is that these something I think help and social workers can really help family is to try and find a playful or even an ironic dimension in the harshness of everyday life, and children love laughing, and we do too. There are even therapies now based on laughing. So the idea, the skill that we can try and pass on is the ability to turn in daily situation into playful interaction. And of course, again, we need to think about the different age of the children and different types of play and the personalities. Some children may be more keen to do some into doing physical based games and play. Others, they like to sit down. Others, they like to explore different elements and be more like doing some experiments with, as in this picture, with bubbles and washing liquid. So it is important though to understand that sometimes adults have lost that playful attitude, sadly, and children can also, in this case, teach us a lot. They have an innate creativity, and they can together help parents to find or refine a dimension of joyfulness and playfulness. So these are some tips and ideas that the research team has put together. And again, as you can see, there's an element of awareness. So as we said at the beginning, being aware, trying to see what the children are in need of, and then discuss with them, communicate, identify some causes, and reflect together. And also, if the child is a bit older, try to ignite self-reflection of why they behave like this, why do they think that, and everything should be also done in view of enhancing self-esteem. So away from judging or necessarily punishing straight away. And here we are led to our last topic, which is under the construct of cultural competence, and has to do with confidence and curiosity in more grown-up children, but which is actually true and should be taken into account since from a very early age, actually. So we know that confidence and self-esteem are key to healthy adulthood and also healthy adolescence. And again, family, parents, and culture are important factors that can influence the building of confidence. And we also know that the earlier children can feel self-confident, the more likely it is that they will be successful. They will achieve what they want to achieve in life, in adulthood. And confidence, it is about having faith or believing that you can in fact achieve what you want to achieve, and that you have a trust in yourselves or in other people around you. You have courage to face difficulties, and you have the competence to do that. And in this way, you can take the right decisions for yourself. And why curiosity is important, where I think that curiosity and self-esteem and confidence are very much signs of a healthy of a healthy child. So children are born eager to learn, and they are naturally curious, if if we let them be, and if the conditions around them support this. So they have an investigative attitude, and it is important to allow it to flourish. So in addition to asking questions, creativity, problem solving, and risk taking, these are all expressions of curious and healthy minds, as well as wonder. And of course, we know that vulnerable families can suffer from sense of monotony, oppressions, or meaningless, depending on what kind of problems are affecting the family. And as we know, it can be hard for children who maybe cannot attend school, or who are moved from one foster family to another one, and so on. But maintaining a curious and engaged approach to life, to people, and to the world is, as we said, vital, and it reconnects to our initial topic around learning, development, and also to well-being. In fact, curiosity and learning are very much interlinked, and according to different age phases, we parents. I mean, I don't know who has children here, but who has experience with very young children. But we know that initially, everything which is around and in what's called, like, the small world is something to. Everything is new, a new word, a new object, a new color, and then so as they grow, children, of course, these get more complex, and so the topics of conversation must expand, and talking about the bigger world or bigger issues is something that can be also useful to keep igniting the curiosity of children. And also, as we also said just during the previous slide, about this idea of being able to making good choices, and what is called practical wisdom. So becoming healthy adults can be rooted in this concept of practical wisdom, because it is culturally determined, but it is also life-saving skill for refugee children, or for any other children growing in more vulnerable families. And it is about educating them in key transcultural values, such as love, kindness, friendship, fairness, and respect of the others. So growing with those values can help loving themselves, being self-confident, but also being respectful of other people and other cultures around them. And again, some tips and ideas in relation to confident adulthood with curious minds. As you can see, again, there's moving away from this idea of failure, and also the idea of being perfect. Nobody can be perfect, and sometimes children do have that perfectionism, which is sometimes negative, because it can prevent them from trying. And of course, also trying or being overconfident can be negative, because it can be dangerous. So it's still, again, it's still a balance between being cautious and being mindful, but also not being too fearful, or overthinking or ruminating around situations, but on the contrary, encourage decision making. So understand, it's important to understand that action leads to confidence, and young adults can gain confidence from their actions, but they also need to understand that there are responsibilities arising from their actions. that they need to plan in advance. They need to start learning that how to plan them in advance and take them into account. And in this sense, parents should not overprotect and try to be role models. And I think this is it. It was I have to say it's been a bit sometimes difficult not knowing more specifically your cases, the families you work with. But these we have tried to put together some guidelines that actually can be applied also in perfectly non-vulnerabilized families. So I hope this has been useful, or at least has highlighted some familiar issues or provided new food for thought. And we are now, I think, going into the group discussions, isn't it? These are the instructions for the breakout rooms, but I can't see. Oh yeah, we have 15 participants, yes, excluding us, and yes. So I think we should we should do, Reina, we should do 3 groups of 5, or
just to remind you that we have a 5-minute break as well.
Oh, sorry. Okay.
Between whilst we're getting the rooms ready.
Yes.
And yes, I think 3 rooms of 5. We're not going to cover all the main concept of cultural competence, but you have some questions, don't you? So are you going to leave the